All right.
Okay, so next up, our final presentation. I am delighted to introduce Sarah Gonzalez, who is a service consultant with UnitedHealthCare. How's it going, Sarah?
Hi, Mike. It's going pretty well. Can you hear me okay?
Yep, we can hear you.
Oh, awesome. I'm having a little bit of an issue with my monitor, so I apologize.
Oh,
But
no
thank you
worries.
so much for having me. I appreciate that.
Yeah, we really appreciate you being here. So feel free to, and you're probably already working on this, but feel free to share your presentation whenever you're
Yeah,
ready.
sure. And
And while you're doing that, I'll just answer this last question that's up on the board regarding Via Benefits. You have
sure.
Medicare, but not through Via Benefits. How do I join Via Benefits? And you would do that by following the instructions in Acera's enrollment guide, which you can find at acera.org/guide. We've also mailed you a copy, so you'll receive that in the mail in your open enrollment packet. And there are instructions in there for how to contact Via Benefits. And so what you would want to do is during open enrollment, which is the month of November, you contact Via Benefits and they will help you find a plan through them. And then the new plan year for those Via Benefits plans starts on January 1st. So once January 1st rolls around, then you would have your new coverage in your Via Benefits plan. Okay, can you all see that?
Yes, it's there.
Great. Take it away,
Perfect.
Sarah.
All right. Thank you. Well, again, thank you guys. And again, I'm so sorry for the technological challenges I'm having today. It's been quite the day. But thank you so much for having me. And just a little bit about myself before I get started. I've been with United Healthcare for 20 years. I'm actually located in Southern California. And again, pretty busy with open enrollment. So I'm excited to actually present your guys' benefits for 2024. And again, thank you, Mike and Nish, for having me. And with that, we'll go ahead and take it away. If you want to go ahead and move to the next slide. So first of all, we're going to go ahead and cover the myuhc.com website, which is our member portal. And in this page, we'll find a plethora of services for our members. There is, as you can see, there's estimated cost of care. If you're looking to figure out, let's say, how much it is cost to see a dermatologist in your area, you get an estimated cost here. You can see what's covered as preventative, what your benefits offer. And I think for me, my favorite part of this website is actually the claims aspect of it. I kind of dabble a lot in that area, and I think that this helps members tremendously because you can see where you are when meeting your deductible out of pocket. And of course, these are terms that I'll cover down the presentation, but you can see claims that are submitted by your providers. You can see claims that came from prescriptions. It links you to other of our sources like our Optum Behavioral Health as part of the website. Now, when you register, that's probably the best, you know, benefit because it ties you to the plan you've elected once you have enrolled and you have your ID and you register. But if you're not registered and you just want to navigate through it, see what what information you can find, you don't need to be registered. You can see at the bottom of the page in the picture, it shows you to find a doctor. And I don't know if we can make this a little bit bigger for me, Mike. I'm sorry.
Can you say that one more time?
I was wondering if you can make this a little bit bigger, but if you can't, it's fine. That's fine.
Yeah, I don't think I can zoom in
No worries, no
on
worries.
it.
I
Yeah.
just want to kind of highlight some of the items that are there for those that are interested in finding doctors, locating pharmacies. Again, you don't have to register, but you get more benefit when you are a registered member. And with that, we can move on to the next page. And then so finding providers, which is probably the one item that most of our members log into this portal for is to find doctors, whether you want to change a doctor, whether you want to join, a different network or one of your doctors and part of a specific medical group. This is one of the advantages of this website, but you also have a couple of other ways to look at that information. So like I said, you can go to the myuhc.com portal. You can actually call the back of your ID card once you are a member and you're registered. And so you have member services that would actually help you find whether your provider is at network or if you're looking to change, like I said, to another doctor. And then, of course, we have the mobile app, which I feel is extremely convenient for everybody. Today we live in the world of technology. And sometimes we have, cases where we, need information then and there. The app would be probably the way to go. And so with that, we'll talk a little bit more about the app. If you can go more into the next slide, Mike, please. Thank you. So here again, it gives you kind of high level overview. So basically with the app, what you have at your fingertips is the MyUHC website portal. You have access to your claims. You can see if you met your deductible or you're out of pocket. If you need to present your ID at a doctor's appointment, you have it at your phone. And I think, of course, you have, to me, the best feature of this, it's 24/7 access, and it involves even video chats with doctors. So that, in a nutshell, is the application. And then we'll go to the next page, please, or the next slide. So here, choosing a PCP. Now, for those that are not familiar with the requirements or how we, can elect a PCP, typically is within 30 miles of your home, your residential or work area, work location. And this is where you actually want to have a primary care physician assigned to you or your family. And you want to get individuals that are in general practice, family practice, internal medicine. Those are typically what a primary care physician is. And for women, it cannot be an OBGYN. Now, if you need to get referrals, of course, to specialists, you go through your PCP will then submit the referral outside of within the medical group, but outside of the PCP requirements. And so you want to look up the information. There's a couple of ways to look up a doctor. You can either by name or last name. You can actually put in the city. You can actually put in the medical group. I mean, there's different several ways for you to actually find if you're looking at a specific provider. Sorry, I got a call. Thank you. No, I think we're good on this one. Again, I just want to kind of point out that with finding a provider, there's also on the website, there's a specific provider ID number that is associated with the doctors. So when we do enroll or we do want to change a doctor, that is the number we want to provide. And that should help you with the changes. And then on this slide, it is for preventative care. As you know, for the preventative care, there's a zero out-of-pocket cost when you go through our in-network providers. And, this is a good time where you want to kind of establish the relationship with your primary care. You want to, create plans for your health services. You want to evaluate your health, talk about your symptoms. And again, preventative is something that we should all take advantage of, especially when there's no out-of-pocket cost to our members. You can go to the next slide, please. Now, these are, again, some of the common terms that I've kind of went over a couple of them, but a copayment is basically something that you pay, like when you go see your primary care physician, you pay your $15 copay for this plan. If you have, if there's services that apply to your deductible or your out-of-pocket limit, when you do get claims processed, you will see those terms in the language in your EOBs. And again, coinsurance. So coinsurance is basically the same as it's part of your out-of-pocket limit. And if you need to understand any other terms, you can just go to the justplainclear.com where it speaks some more common terminology used for those that are in the healthcare industry. You can go to the next slide, please. Virtual care, virtual primary care. This is a wonderful benefit for everyone just because this is where if you don't want, you don't have time to leave home, you're out of state, you're traveling, you feel you may see a doctor for just common services like preventative, or maybe if you're coming on with a cold, you're trying to determine, should I go to urgent care? Should I go to the emergency room? I just need a quick take, someone to talk to. This is where you want to access the virtual primary care feature. And virtual means just that. It's not necessarily in front of the camera. We all know sometimes, we're under the weather. We're not really up to par, but you can do this through email, through chats, different methods that are virtually available to you guys. Next page. Or next slide. Sorry, I don't know if you've seen page. Okay, so here we're going to actually get to actual plans for 2024. It's going to be a high-level overview, but if you guys have any questions, by all means, let me know at the end of the presentation. So the plan is going to offer the Signature Value Premium and a Signature Advantage Premium. And both of these plans have a, oh, I think it's on this next slide, I'm sorry. On the next slide has a $15 doctor, PCP and specialist copay. So whether you go to see your primary care physician or you're referred out to a specialist, your copay is $15. Any inpatient services are no charge. Emergency is a $50 copay. Now, if you get admitted, because I know sometimes we go to the emergency room and we'll be there for a couple hours, probably half a day, and we don't get admitted, then you only pay your $50. If you do end up getting admitted, then that gets waived. Urgent care, which I think is really great, is $10 for this plan. And then virtual visits, as you can see, it's a $15 copay, same as your PCP and your specialist. And then lab and x-ray, no charge. Your out-of-pocket maximum individually, you have a $1,500, and then family, you're looking at $3,000. So for the family, whether it's collectively as family members or just two of the family, if you have a family of two or more, then the $3,000 would be satisfied. And the next slide, please. And then right here, we're just going to take a look at some of the medical groups that we're aligned with. Signature Value Advantage does work very closely with Canopy. And for those that are familiar with Canopy, we have some primary groups that we typically deal with on the Canopy side. But again, it goes outside of those hospitals and medical groups. And as you can see, there are nine. There's nine in the Bay Area and about 5,000 providers altogether. So you do have, again, a plethora of providers to choose from within this network. Next slide, please. Okay, so here we're going to get into the benefit information for pharmacy. We're going to talk about your tiers and the cost. So again, if you have any questions, let me know at the end of the presentation. So tier one, I mean, it's pretty much the lower, most generic list of medications, because as we know, most pharmacies, when you go get a prescription, oftentimes they will dispense the generic because it's equivalent to whatever the brand name is. It has the same therapeutic class. So this is where you save the most money. If it is medically feasible for you to get a generic, this is the route you want to go. And again, you get the lower costs there, most savings. Then you get to your tier two. You do have mid to range because this can vary between, as you can see, mix and generics. And then, of course, you have your tier three, where it can be a mix of mid and range, but overall it covers a lot of brands. And again, sometimes with the tier changes or the PDL changes that happen throughout the year, we will have brand medications. They will actually change into the tier one because, again, the way they are made up of the therapeutic classes. So a brand name does not mean you're always going to have a higher tier. It could be that you would be paying a tier one. So it all depends on the time of the year and the PDL for that season. And we can go to the next slide, please. And again, here are your tiers. For tier one, you have a $10 copay. Tier two, you'll have a 25. Tier three, again, which sometimes it's the brand, it's the 35. But again, depending on the medication, they can fall onto either tier, and the copay will apply. If you do have questions, this is where you want to actually reach out to Optum RX through the back of your ID card to confirm the tier structure and what your applicable copay is. And then again, your copays is something that would actually go towards your out-of-pocket maximum. Thank you, Mike. Next slide. And the advantages of home delivery. So with home delivery, as you can see, for most of the medications, there's free shipping. You get a 3-month supply at a cost of 2. There's less, of course, with the retail. And there's 24-hour service pharmacist, and there's no refill reminders. Once you are set up through mail service, you are automatically get the refill, and just the notification is for the payment, and your medications are shipped. Next one. And then the next section, we're actually going to talk about some of the benefits we have available through the Advocate program. And so we want to go to the next one, Mike. Thank you. So when you have an Advocate for Me assigned, or when you call the back of your ID card and speak to an Advocate for Me, they actually walk you through a lot of these items. They actually help you understand your benefits and claims. They can actually help you reach out if you have questions, if you're having any questions about your services with specific providers. They can actually also reach out to your providers and have discussions about medications. They can help you obtain updates on any prior authorizations that your provider may be working on. any type of approvals for surgeries, things of that nature. They can go through bills. If you get a bill from a provider, they can compare that to the claims that are on file to make sure you're getting a bill for the correct copays or the correct deductible amounts or coinsurance. And then next slide, please. And then here is where we're going to cover a little bit about Optum Behavioral Health, which is the behavioral health department that manages our mental benefits. And here, this is again through the back of your ID card. There should be a direct number for Optum Behavioral Health, but if not, you can also go through member services, and they will actually connect you with a clinician. They will assess the call while on the phone, and then connect you to the appropriate individual to help with your questions and concerns. And again, if you have questions about whether a provider is contracted or not, whether the service requires a prior auth, this is the department that would actually help with that. And so UHC Rewards is a fairly new program, but again, it's to incentivize individuals that it's employee and spouse accounts to actually get healthier and in return get a reward of $300. And typically, it's something as simple as tracking your steps, which I know a lot of us actually do. We carry those. I forgot what they're called, the watches where you count your steps. But I know that's very popular with a lot of people. So I usually bring that up. You're already doing that. You're walking, keeping track of steps. You might as well get money for it. And again, it is employee and spouse each get up to $300. Once you've completed that, the reward, it is sent to you in a Visa card. And the next slide, please. And so this is our Real Appeal, which is a weight loss program, comparable to some of the other programs that are out there with other carriers. But again, this is another incentive program to help people stay healthier. There's a lot of good tools here where you can actually pair up with a coach, teach you how to eat healthier. Again, try to keep track of your goals. A lot of us get so busy with work, we kind of get distracted. We lose track of our, some of these things. So this is where you get that one-on-one coaching partnership, if you will. Thank you. And then virtual visits. Here we're going to talk about, again, some of the common, I lost my train of thought. Some of the benefits to virtual visit 24/7. Again, if you are traveling, if you are just wanting to get a quick connection with someone to see whether you need to go in person, if you need to go to the ER or the urgent care, this is a good way to connect with a doctor that's available and give you, medical guidance at the tip of your fingers. Next slide, please. Oh, I think I flew through that really quickly. So I guess that's all. Thank you so much. I guess I'll go to questions.
All right, sure. Yeah, there are a few questions up on the
Okay.
board. Okay, first question. What is the current percentage of doctors in your network that are open to new patients? If you know.
To find the percentage, I would have to actually go through our contracting team to find out. I don't know that. I apologize.
Okay, yeah,
I'm going to make a
sorry
note
that we
really
don't
quickly.
have the answer to that question.
Percentage of doctors.
Okay, next question. So the question is UnitedHealthCare separate from VIA benefits for people under age 65? Yes, that is correct. If you're not yet Medicare eligible, we have those two UnitedHealthCare plans that you can optionally enroll in if you would like to seek medical coverage through Acera. And so your three group plan options, if you're not Medicare eligible yet, are the Kaiser Permanente plan and the two UnitedHealthCare plans. And then if you live outside of one of those if you live outside of the service area for those group plans, then you could choose an individual plan through VIA benefits. Now, once you're Medicare eligible, then your options are the Kaiser Permanente Senior Advantage plan and an individual plan through VIA benefits. So that we don't have a UnitedHealthCare group plan once you become Medicare eligible, but you can find individual UnitedHealthCare plans in the VIA benefits private health insurance exchange. So they do have individual plan options that you can find if you like to get a plan through UnitedHealthCare. But yes, you're correct. Under under age 65, when you're not yet Medicare eligible, you're looking at these two United Healthcare plans or the Kaiser Permanente plan. Those are your group plan options. Okay, next question. The question is, in your presentation, are you covering the United Healthcare HMO programs? And does your presentation apply to those people who are Medicare eligible, who are in an individual United Healthcare plan, and it's the AARP United Healthcare plans through Via Benefits? Does your presentation apply to any of those Medicare plans in Via Benefits?
I'm sorry, we're talking about the My UHC rewards programs, or
I
the benefits that are available
I
through My UHC, that whether.
I think, yeah, maybe just the plan design in general and the different benefits. And my guess is that, the individual plans probably have an entirely different set of plan design and
Right, right.
benefits.
You are correct. I mean, there are some similarities. Like I said, like as an example for the Medicare side, we on our commercial side we have the Real Appeal, which is the program to lose weight for healthy living, and then on the Medicare side they have something comparable called Silver Sneakers. So there are some similarities, but no, this would not specifically apply to both, if that makes any
Okay.
sense.
Okay. So next question. We are planning on moving to Oregon in the next 2 years. If Kaiser isn't available, how long will the lag time be before I can get medical and dental benefits through a new plan? How many medical plans are available to me as a retiree living as an Oregon resident? Now, if you're moving to Oregon, that means that you are going to be and you want medical coverage through a Sarah. That means you're going to be either, like you said, looking for, if you're in one of the Kaiser service area for their individual plans up in Oregon, you could get an individual plan, up in Oregon through Kaiser. Alternatively, you would be looking at finding an individual plan through Via Benefits. Um, and so, in order to figure out what your options are, you would need to contact Kaiser to see if you're interested in getting into one of their individual plans. And if not, or you're interested in contacting Via Benefits, you could contact Via Benefits to see what your plan options are, depending on where you move to. And it is going to be based on your location, and then Via Benefits is going to ask you a lot of other questions like, um, what level of coverage do you want, or how much money do you want to spend on a plan, different things like that. And that will determine your plan options. And Ish, do you want to add anything about that?
Well, yeah, pretty much. We get calls and inquiries about people relocating, and they want to know what's available to. Well, to know that, we need to know what the zip code is and what address are you going to be at when you're over at the other location, because that's where the carriers would need to know so that they can confirm that you're in the service area or out of the service area. So Kaiser in Oregon, they would need to know where you're located so they can see if you're in the area or not. And clearly, if you're not, then of course you would need to still have the address and so forth, so that Via Benefits can determine what's available in the area that you're looking to go to. Okay.
Okay, thanks.
Mhm.
And there's in the next question, it's basically kind of a similar question to the earlier one regarding, is this United Healthcare presentation, does it apply to the Medicare individual plans? And it like we were saying earlier, some of these programs are likely going to be available through those individual plans, but you would want to contact United Healthcare directly to see which programs are available in your specific United Healthcare Medicare plan. Is there a way that they can do that online, Sarah? Can they go to United Healthcare's website and see a visual of their own plan design?
They would need some of the plan information in advance, but they can't see that beforehand.
Okay. So
Hmm.
yeah, that's what I would recommend is going out to United Healthcare site and logging into your account there to see
And again, Just to clarify, and I apologize, didn't mean to interrupt, but again, if you're already a member and you're registered, that's the best route. But if you're looking to join, then yes, you can, but you just need additional information to confirm whether the programs are available or not.
Okay.
Mhm.
Thanks for clarifying that.
Yeah. And just to make sure we're all on the same page, the presentation that you just saw, this pertains to Acera's United Healthcare group that we're offering. Okay, so if you're looking at something that's outside of other than what we offer in this plan, then if you're outside the service area of our plan and you're trying to go through via benefits, then you would contact via benefits and let them know where you're located, and they can see which United Healthcare plans are available in the location that you are residing. Okay, but this presentation is based upon what our group offerings are. Okay.
Right. And what you're seeing on the slide here is the two offerings, the signature value premium plan and the signature value advantage premium plan.
Yes. And we do not have a Medicare plan through United Healthcare for Sarah. So if you're looking at United Healthcare and what Medicare plans they offer, you need to contact via benefits, and then they can assist you with what may be available on the market out there.
Okay, next question. Is the virtual visit with your provider, or is it with your provider, or is it someone who is part of a pool of providers and readily available?
That is correct. So it's not necessarily with your assigned primary care physician. It's anybody that's available and licensed in the state or the area where you're located.
And that's great because your provider, whenever you need them, at the last minute, is probably busy.
Right.
So it's nice to be able to have somebody who's there ready to do these virtual visits.
Yes.
Okay, next question. Okay, is UnitedHealthCare similar to the Kaiser program, or can we have both? Well, they're similar in that they're both medical insurance plans. The answer to your question of whether you can have both is you cannot have both. You have to pick one or the other. And I think probably a good way to compare them is to go to our enrollment guide. Let me just show that to you here. So here is our 2024 retiree enrollment guide. You got this in the mail. If you haven't received it yet, you can visit acera.org/guide and see an electronic copy of it. And if you go down, there's a section that
Page
compares
12.
Page 12, that compares the plan offerings of the Kaiser Permanente HMO versus the two United Healthcare HMO plans. And so that's a good starting point to compare those two plans. If you want more details, you can contact both of the plans directly and to do a more detailed comparison. Does that make sense-ish? Do you want to add anything?
Yeah, the contact information for our plans and the group numbers are on the back cover of the guide that Mike is showing you right now. They're right there, so you would need to know the group number, and also that way they can identify which plan you're speaking of. And of course, the websites are right there, and also the phone numbers to contact them. So you can do that, and they can provide you with information and answer any questions you have pertaining to the plan itself, as it is with our contract with those carriers.
Thanks.
Mhm.
Okay, next question. The question is, I was told Kaiser was the only Acera group plan. Is that no longer true? That is true if you're Medicare eligible. If you're Medicare eligible, your only group plan option is the Kaiser Permanente Senior Advantage plan. And then your other option would be to find an individual plan through Via Benefits, for which you could seek a United Healthcare plan through Via Benefits. Now, if you're not yet Medicare eligible, then we have 3 group plan options, which is Kaiser and these 2 United Healthcare plans that Sarah was just outlining. Okay, let's see. Are there any other questions concerning United Healthcare and our 2 group plan offerings? Okay, I think that concludes our questions. So I just want to thank you so much, Sarah, for joining us and providing that excellent presentation. the UnitedHealthCare benefits seem to be very comprehensive, and I really appreciate you being here and walking us through them.
Oh, well, thank you both for having me. And again, if you have any questions, let me know.
We will do that.
Thank you,
Thank you.
Sarah.
Have a
Yeah.
good day, everyone.
Yeah. Thanks, Sarah. Well, that brings us to the close of yet another successful Acera virtual health and wellness fair. I hope you all enjoyed it. We love doing this for you. Okay, so like I was saying at different points during the presentation, like we said in the intro, we have recorded this. And so what we're going to do is chop up this big recording into individual presentations. So there will be one individual video for each presentation. And we will then post that out on our virtual health fair webpage. If you go to acera.org/health fair, you can find that. And we're going to be, it takes a little bit, takes a few days to edit those. So we're looking at midweek next week probably is when we're going to post them, and we'll post them right underneath the section for each of the presenters who provide a presentation. So you'll see the link to the video in each one of those sections. So again, that's going to be midweek next week. And then the Acera Health Fair page will be up during the entire open enrollment. So please feel free to go back and refer to that during open enrollment. All right. So do you have anything else you want to say before I conclude, Ish?
No, just look over all the materials, see whatever works best for you. Again, and if you don't have any changes, you don't have to complete any forms or anything like that. Your plan would just roll over into the next year. Okay.
Great.
So any questions, you've email us, Sarah, at the Sarah info, or give us a call and we can assist you with whatever questions you may have.
Excellent. Thanks,
Right.
Ish.
Stay safe, everybody.
All right. On behalf of Acera staff and our board of retirement, I want to thank you for spending this time with us today. We wish you safety. We wish you health, wellness, and joy. We wish you a beautiful rest of your day and a beautiful life. Until next time, thanks.